Basically, it's less robust than a full approval, but more robust than an emergency approval. It grants approval for 1 year, and then the evidence, as the vaccine is rolled out, keeps being evaluated on a rolling basis. It's only possible in health emergencies to give an authorization like this. At the press conference held by the European Medicines Agency just now, the EMA's executive director, Emmer Cook, noted that this authorization came in just 11 weeks when normally this type of authorization takes 3 years, but she said that this was a really thorough, robust evaluation that the public can have confidence in because the EMA basically worked around the clock to make this happen. Now, it should be noted that this is different than the emergency approval that the UK granted for this vaccine. The UK is actually still subject to EU law, but any EU member state could have, at any point prior to today, authorized this vaccine on an emergency basis, but no EU country did that. The UK is the only country that did. And some legal analysts say that that could open up the UK to potential liability if anything goes wrong with the vaccine, but because the EMA has gone for this longer process that lasted a couple weeks longer, it means that the company would be liable rather than the governments themselves, although I think that's still subject to legal analysis. The main point is this is a pretty thorough evaluation that they've given, they said the public can be confident that this authorization has been robust.
Talk to us about the logistics. When can Europeans start to get the vaccine?
Well, this is a recommendation for approval. The approval still needs to come from the European Commission, but Commission President Ursula von der Leyen just said that she expects the Commission will rubber stamp this decision by tonight. That means that the EU should be able to go ahead with its schedule of starting vaccinations, actually needles going into arms, across the bloc on Sunday. They're going to start sending out the vaccines now, and by Sunday they expect the very first person will get vaccinated. It's not clear yet which country that will come in, but the idea is that that's going to be happening across the EU all at the same time. It may be that not every single EU country vaccinates on that day, but they'll at least have the ability to, and probably a number of countries will have vaccinations on that day, and then they will continue. Across the EU, they've developed plans catered to each member state about who's getting the vaccine in what order, but the main point is they're all getting it proportionate to the population at the same time.